Recent studies have shown that taking a low dose of aspirin every day can prevent and possibly even treat cancer. Joining us now is Dr. Ignacio Valdez of Boca Raton Regional Hospital to tell us much more. Dr. Valdez, first of all, thank you for joining us.
Oh, thank you for having me.
Well, let's talk about this. How will this change things?
Well, in the past, we've recommended aspirin only to high-risk individuals for heart attacks and strokes because of the fact that taking aspirin does carry risk. However, when you throw in the benefits of cancer prevention and even treatment, certainly the benefits will way outweigh the risk. Sure. And so we will be more recommending aspirin more freely.
That's very nice. Cancer is a very broad brush when describing the condition. Is there a particular type of cancer we're talking about here?
Yes, Dr. Roswell out of Oxford studied over the last several years. Now we've known that aspirin will help prevent and reduce colon cancer over 8 or 10 year period of taking aspirin. But these recent findings show that they have a short-term effect, mostly on adenocarcinomas, which are cancers of the gut, some lung cancers, some breast cancers, prostate, pancreas, and those show that the most reduction now.
Okay.
Intestinal cancers such as colorectal cancers, after 5 years of taking aspirin, will reduce up to 50%. Wow. And esophageal cancer was reduced up to 70%.
Large percentage.
Now, another study, separate study, showed, and this was just released last week, that it reduced skin cancers.
Nice.
2 kinds of skin cancers, squamous cell and melanoma, which is a dangerous, deadly cancer.
Of course. Is there anything in particular that it does working into that cancer? Exactly what does it do when you take the aspirin?
Well, it's its anti-inflammatory properties.
Yep.
It inhibits COX-2, which actually helps cancers grow. So that is the proposed mechanism.
Okay. We've also heard that in recent years, aspirin has been credited with reducing heart disease, asthma, and Parkinson's disease. Can aspirin be considered the wonder drug here?
I think so, yes. It's too early to tell whether we will be recommending this on a broad spectrum, but it looks promising. Now, the studies were intended to look at heart disease, but they also collected data on cancer. So the results may be flawed, but it looks very promising. I think that cancer specialists are very happy about this, and the fact that it can prevent cancer spread. I think anybody with a diagnosis of cancer that hasn't spread yet should be taking aspirin, and I think that
all very good points. All right, well, Doctor, thank you very much for joining us today. And Boca Raton Regional Hospital sponsors our expert and underwrites our Ask the Doctor segment.